Fine particulate matter is an air pollutant, and they're very, very small particles that tend to penetrate extremely deep into the lung. And the sources of fine particulate matter is mostly power plants and the car and traffic and other type of combustion sources. And I think it's important to keep in mind that the main sources of greenhouse gases emissions are also the main sources of fine particulate matter. Ozone here, the ozone that we included in the study is the ground level ozone, and ground level ozone is a form of also air pollutants, and ozone comes from nitrogen oxide, which the main source is traffic, and NOx interact with temperature and sunlight to form ozone.
In this study, we use long-term exposure to quantify how much the people breathe air pollution. So long-term in our study is defined by the yearly average of PM2.5 and warm season average of ozone. So speaking of the health effect of PM2.5 and ozone, PM2.5 is so small, it can go deep into your lung and even enter your circulation system. It can cause systematic inflammation, can affect your vascular function, can also change your heart rate variability. So many adverse healthy healthy outcome. It can cause some cardiovascular disease, some respiratory disease, and even death. And also, it can cause some irreversible damage to your lung tissues. So multiple health effects. So actually, we use one supercomputer provided by Harvard. At some point, we used all the computational power from that supercomputer. So we took years of efforts to build this data framework, to build this data platform to benefit future researchers. And also, it's worth mentioning that all the data either come from the government or come from some open source. So it's, in principle, reproducible.
So let's talk about what we found. I think that by the ability of estimating exposure to air pollution in areas that are unmonitored, we were able to estimate health effects of air pollution at very, very low level. And that's something that has never been studied before, as well as looking at whether there were some subgroups of our population that were more vulnerable. So we found in a very simple term that if you were to reduce long-term exposure to fine particulate matter by only 1 microgram per cubic meter, which is a very little amount, we will be saving 12,000 lives a year. And for the effect of ozone, if we would lower only 1 ppb, 1 unit in long-term exposure of summer ozone, we will be saving 1,100 lives a year. Only specifically within the population that we study, so only among the senior citizens. That means that if we were going, if we would have able to do a study on the whole population, probably the number of lives saved would be much larger. We were also able to estimate with a tremendous amount of precision the risk of death associated with exposures. They are very well below the national ambient air quality standards. And I think that speaks to the fact that we found such a strong and very precise evidence of increased risk of deaths for exposure below the national standard. It really speaks about the fact that we need to stringent our safety standard even further. So in terms of policy implication, I think the most important message we hope to come to send across is that whenever we're talking about climate change and whenever we are talking about steps to reduce greenhouse gases emission, we tend to think about what will be the adverse consequences 100 years from now, 200 years from now, with respect to glaciers, with respect to extreme weather events, which is all absolutely true and valid. But one thing that we hope to be, the message that we hope to be sending in this study is that by acting on reducing greenhouse gases emission, we will be acting on exactly the same sources that are contaminating our air. And so a step forward toward climate change, it means immediate benefit, immediate co-benefit in having our air more clean.